former Unipharma graduates fellow, and she's Claudia Fabiani. Now she works at Sapienza University of Rome in our university hospital, the Policlinico Umberto in the Rare Diseases Center. Thank you for joining us today, Claudia.
Thank you for the invitation. I am currently working at the Center for Rare Diseases as an ophthalmologist. So, as Professor Sasso has reminded us yesterday, I was an exception because I was a medical student when I was a recipient of the Leonardo program, and I was an undergraduate student. So in 2004, after a tough selection, not kidding, I was admitted to the program Leonardo da Vinci for undergraduate students. I was a 23-years old medical student from the University of Rome La Sapienza, willing to become an ophthalmologist. I was a stem cell. I was a childhood in the career of my research career. I went for 6 months at the Instituto Ophthalmologico di Alicante, ISUM, which is one of the most advanced and technological investigative ophthalmological institutes in Spain. One of the best and most up-to-date European centers specialized in the study, diagnosis and treatment and surgery of eye diseases. During my 6 months training, I've worked along with clinical and research fellows from all over the world. Research opportunities at VISUM included basic lab research on ocular immunology and pathology. I've personally conducted a clinical research which gained publication in 2006, but more important, I've started to be interested in the molecular and cellular mechanism of inflammation as they pertain to ocular pathologies. After 1 year in 2005, thanks to the gentle Leonardo, I could apply to a research fellowship program at the Sapienza Eye Research Institute, which is our university affiliates institute, on ocular surface and corneal inflammatory disease. This was the work we conducted at the Sapienza Research Institute, and we investigated the relationship between desiccating stress, release of pro-inflammatory cytokines, and apoptosis cell proliferation in a mouse model of dry eye. After that, from 2006 to 2009, I performed my residency in ophthalmology at University of Rome La Sapienza, where I received additional high-quality training on immunology and uveitis under the supervision of Professor Pidetti, one of the leading world experts in this field. During my residency program, I have continued my clinical and research activity on ocular infections and autoimmune diseases at the Ocular Immunovirological Service of Policlinico Umberto, the University Hospital. After that, I attended a PhD program on infectious diseases at the University of Rome La Sapienza, investigating the relationship between TBC infection and the rare autoimmune ocular disease, serpiginous choroiditis. Now I'm currently working at the Rare Disease Center. We diagnose and treat uveitis, and especially Behçet's disease, Fuchs heterochromic iridocyclitis, and Vogt-Koyanagi-Arada syndrome. Uveitis is broadly inflammation of the uvea. The uvea is the middle pigmented vascular structure of the eye and includes the iris, ciliary body, and choroid. Uveitis is usually an isolated illness, but can be associated with many conditions, including diseases, autoimmune or infectious, with major involvement of other body parts, as well as syndromes confined to the eye. Onset of uveitis can broadly be described as a failure of the ocular immune system. So as I feel still a stem cell and a childhood, I'm trying to do more research because I think it's very important to investigate, and I learned it from Progetto Leonardo, also as a doctor. And so we are studying the effect of hypoxemia on ocular surface and also ocular psoriasis and inflammation. So the take-home lesson to me was that circulating people means circulating of ideas. Research needs the free circulation of people and economic support. Thank you very much.
Claudia, for this very nice presentation and testimonial. So we had some medical doctors, very few in the beginning, not anymore. Any question for Claudia? So, is it difficult now for you to do research? Are you applying for grants also? Are you using your experience, let's say, maybe to look for European grants or just, kind of find financial support for your research?
Yes, I'm trying right now to apply for a grant as a PI, and also I think this workshop was very important to know about other grants we have in Europe and to think in a European way now.
Yeah, because now, if you say the Horizon 2020, there are other opportunities, so you have to try to look for funding opportunities so that you continue to sustain your research. Other questions maybe?